Hi, everyone, and welcome to Ask the Blood Detective. My name is Dr. Michael Wald, and today we're going to talk about everything you need to know about vitamin supplementation. But why the heck should you even care? Well, you should care for a couple of reasons. If you're listening to the show, I'm going to guess that you probably have some basic or even advanced knowledge in the use of nutritional supplements. And let's first give a brief definition of what are nutritional supplements. They're concentrated forms of various nutritional compounds that have been put in either, let's say, a capsule form, a tablet form, maybe it's a powder form, a liquid form, even topical creams. So these nutritional compounds. Now, when I talk about vitamin supplementation, today we're going to talk about vitamins in various forms that you can, let's say, purchase from a healthcare provider, from a health food store, but also minerals, various phytonutrients, amino acids, and I might also mention something about macronutrients, which are protein, carbohydrates, and fats. So I've been in the holistic nutrition field for about 30 years now, originally having gone to chiropractic college, learning a great deal of nutrition in chiropractic college, but I wanted more. So I eventually got my master's degree in nutrition, and then went to medical school. I graduated medical school. I got my MD diploma, but I decided not to become licensed in medicine. But that's besides the point. I'm just trying to impress upon you that I'm hungry for knowledge, always have been. And I can tell you that in medical school, during my medical school experience, there was virtually no mention of nutritional supplements except for extreme vitamin C and niacin deficiencies, for example, that were prevalent in the 1950s and prior to that. So our nutrition education, for example, in various colleges, is way, way, way behind the times. And they're not teaching this information on nutritional supplementation. Now, if you're going to seek advice from some form of nutritionist, I urge each and every one of you to check the background credentials of whatever practitioner you go to, because we're simply not all the same. So, for example, from chiropractic college, I learned a good deal of nutrition, but then I got my dietitian's degree. And in the state of New York, which I reside in solo practice in Chappaqua, which is in Westchester, New York, there are basically two recognized nutritional certifications. One I just mentioned, that's a dietitian's license, and the other one is a CNS, or Certified Nutrition Specialist. And there are lots of weekend courses and short courses on nutrition that practitioners out there are using and trying to convince the public that they have enough of a fundamental background in nutrition to give you the best quality nutritional care that you can get. And I think common sense will tell you that probably a longer period of experience and the greater number of certifications and diplomas is probably who you want to see. Okay, so just a little bit about that. Now, any comments that you have on this topic, I'd love to hear what you've got to say. And this is how I determine topics, by the way, everyone, is that I ask you to email me what your topics, what you're interested in. And you can do that by emailing me at info@blooddetective.com. That's info@blooddetective.com. That's one word with two Ds, Blood Detective. And you can also email me through my website, which is drmichaelwald.com or drmichaelwald.com. Okay, there's lots of free content on my website, so you can search the search bar there and even find another podcast I did on everything you know about vitamin supplementation in the past. You can never reiterate a topic like this because, you can get the most fantastic and accurate nutritional and health tests, and you can have uncovered every diagnosis that you've ever desired to look at in terms of your own health. But if you don't know how to manage supplementation properly, then all you're left with is, let's say, food improvements, which are, of course, important. So let's start with that as a question. I have in front of me here, I don't know if you can hear my papers rattling in the background, but I've got about 150 questions here about vitamin supplementation. So I'm going to go through as many of them as I can here. So the first one, the very popular one that I hear is, people will say to me, Dr. Wald, which is better, foods or nutritional supplements? And again, I don't like the formulation of that question because they're both equally good in terms of having an equal or a significant impact upon one's health. So we can't substitute foods for nutritional supplements and expect to live well over time. And vice versa is we can't expect to eat a good diet, whatever that is, and that's the best scenario, and not think that we need to fortify our diet with various nutritional supplements based upon our genetic needs, our current health problems, maybe to offset side effects or even intended effects of various medications to improve healing. And then for particular diseases, whether we're talking about diabetes, heart disease, autoimmune diseases, arthritis, you name it, there may be a role in terms of use of nutritional supplements. So my answer to the question, which is better, foods or supplement, is that they are both extremely important considerations for every single person, at least every single person that I see. I always lay the foundations of what I feel an individual's healthy diet should be for them at that time. And almost always, because people see me that are trying to catch up with their health, to reduce chronic symptoms, they want to be asymptomatic, they want to live healthy lives, they want to be able to explore life in all of its wonders, but they can't because their bodies are not functioning well. If your health condition, and this is true in every single case of any chronic health condition, your health condition is a degenerative process. And unless your body's regenerative capacities exceed the degenerative capacities, your health problems will continue to go on and on. When a person has chronic health problems, and I believe this is a fair generalization to make, the body hyperutilizes nutrition. So chronic states of stress, like healing in the body, that's a form of stress, will increase your body's needs for various nutritional supplementation. So let's say you have any sort of autoimmune disease. What I find across the board is that these individuals tend to be deficient in vitamin C. And we need vitamin C to do lots of important things in the body. And the least of which is certainly not healing of various types of connective tissue, whether it's ligaments, tendons, muscles. These sorts of tissues must have vitamin C present for repair. And when there's disrepair due to autoimmune inflammatory conditions, our utilization of nutrition increases, our need for various nutrients increases, sometimes exponentially. So yes, I believe we need nutritional supplements and we do need a healthy diet. Another common question that I hear from people is, do nutritional supplements even work? Well, of course, that does depend on the quality of the nutritional supplements and what company has produced them, because not all nutritional manufacturers are the same. So what I do is, if a patient of mine would like to continue taking supplements that they've done their own research on, or they heard somewhere that they're good and they work, usually all people can tell me is they'll say, Dr. Wald, I know that my supplements are of good quality because my acupuncturist recommended them or my nutritionist recommended them. That doesn't mean that they work. One of the first questions you'd want to ask if you really want to explore the quality of the supplements that you're taking is you want to call the company and say, could I have a full disclosure of the supplement in question? So a full disclosure label is a third-party assay of what is in that product. And I only like to use pharmaceutical-grade nutrients with my clients. And those, by definition, are nutritional supplements that have met the highest quality manufacturing and absorbability and purity requirements. I won't go through what those all are today. That would take up more than the show time. But just know that there are such qualifications, and it's important that you find out if you're not trusting your healthcare provider, or you want to know firsthand if the supplements you're taking are good quality. Because if they're not, they are not going to work. And if they are good quality, well, they might work if they are prescribed correctly for your individual health problems. Okay, here's an odd question that I received recently, but it's a good one. And here it is. Are supplements contaminated with fungus, heavy metals, and other infective and toxic agents? The answer is that yes. From time to time, we will be hearing in the news that this or that supplement is contaminated. A recent one I heard was a spirulina, which was heavily lead contaminated, you see. And a certain amount of lead is allowed in most herbs during the growing process and the final assay of that product, because we can't remove all the lead most of the time. But the FDA says, well, the amount of lead in and of itself in this particular product is not harmful. But years ago, I called the FDA and I asked them about that statement. And I said, well, okay, so let's assume I'm taking a certain herb and there's a certain amount of contaminant, let's say it's lead, but you're saying, FDA, that that amount of lead is not harmful, generally speaking. But if we breathe air, we're also exposed to lead. And there's also lead in a variety of other sources or locations, let's say, in our lives. And when you add it all up, commonly it is quite toxic, but the FDA does not add all of it up. That's not how they operate. So it's up to us to make sure we're not adding any extra toxins like lead or other heavy metals or fungal agents into our supplements. Now, some companies, when they're manufacturing their herbal products, let's say like in China, and they dry these herbs on the side of the farm, let's say, fungi and other contaminants such as pesticides, herbicides, and fungicides are commonly used. And when you eat these herbs, you will be eating these products. So the products themselves can make you sick. Sometimes healthcare providers will give you a product that they don't know what the quality control is. The patient will have a bunch of symptoms making them look like they're sick because they are. And sometimes the practitioner will say, no, you're detoxing. So you can see how this can lead to some real confusion, clinically speaking. So yes, are supplements sometimes contaminated with fungus and heavy metals? They certainly are. So it's up to your healthcare provider or you to get a full disclosure label to see if this is so for any products that you decide to take. All right, here's another question I get. This is a great one. Are all nutritional supplements the same, and how do you prove it? Well, for example, I might recommend a certain, let's say, folic acid product, that's a B vitamin product, to a client, and they'll say, well, doctor, well, no, that's fine. I already take one. So I will look at the folic acid and the form of it. So, for example, I would prefer a methylated form of folic acid. That tends to be more assimilated and useful in the body, let's say overall. And if a person has a product where it doesn't specify that the folic acid in their product is methylated, it probably isn't, because most companies would like to brag about that. And methylated nutrients are usually a little bit more expensive than non-methylated nutrients. So, are nutritional supplements all the same? Of course not. The other way of telling, although this is tricky, is you might try different supplements and see how you feel. But I can tell you, the human mind is very interesting this way. You can take a nutritional supplement and swear that it's working for you, let's say in a day or two or a week, and then you try another supplement from another company, it doesn't seem to work. I find that people's assessment of whether or not things work are really all over the place. You really don't have any way of telling on your own. So what's the solution? The solution is, if you say you're feeling better with a certain supplement, and if I prescribed that certain supplement based on specific lab findings, so for example, one of the best tests for folic acid deficiency in the body is not the blood level of folic acid. It's the size of a red blood cell as viewed under a microscope at high magnification. So, for example, if you have large red blood cells and you don't have a history of cancer or use of chemotherapy or cholesterol over 300, all of those conditions can cause large red blood cells, then you probably have at least a folic acid deficiency. When you're deficient, that means you just don't have enough of a product. Or if you're insufficient, meaning you might have a normal amount of the product in your chemistry, but it's not enough for you for your purposes, the red blood cells will get larger. Now think of this, folks. If your doctor, and this is common, they'll measure your folic acid in your blood, and if it's normal, they'll say you're fine. But if you have these large red blood cells, it means that the folic acid that's outside of your cell is not getting inside of your red blood cell, and then it's assumed it's probably not getting into a lot of blood cells in your body. So the red blood cell gets larger and larger and larger, which in and of itself has its own problems, because large blood cells don't oxygenate properly. They don't provide proper circulation. They even increase heart disease risk because these larger red blood cells are heavier and they have to be circulated, so it can stress the cardiac system. So suffice it to say that not all nutritional supplements are the same. The experience of the practitioner might count for something. Your research by calling a nutrient company and asking for third party disclosure. These will help to determine whether your supplements are of high quality or not. And of course, are the supplements you're taking changing abnormal chemistry into normal chemistry? That's the ultimate test of whether or not supplements are working for you, and if one brand is better than another. The other question I get a lot is they'll say, Dr. Wald, which is more important, synthetic supplements, or which is more, let's say, bioavailable, synthetic supplements or natural supplements? Now, the naturalists will always say natural supplements, but I can tell you it's just not true. There are certain forms of synthetic nutrients that are purified, for example, and or concentrated in certain types of the particular nutritional compound, which will make it more utilized in the human body. So I can say from, again, my 3 decades of experience recommending nutritional supplements and improved dietary habits with individuals, that sometimes natural supplements may be the right choice for a person, and other times synthetically produced supplements may be better. So it's not black and white. It doesn't have to be, folks, this or that. There can be instances where synthetic supplements versus natural or vice versa are the right thing to do at that time. Now, if a client sees me and says, blood detective, I want you to only recommend natural supplements for me, I will do that. But if there are limitations with some of the natural supplements for particular, let's say, abnormal chemistries for a person, I will let them know that. And it's up to them with this information to make their own educated choice. But I do believe, as I mentioned a few times, that there is the right time and place for nutritional natural supplements and supplements that are synthetic. Okay, should supplements be regulated by the FDA? So this is, again, a loaded question. I can certainly say that various medical technologies that I have, machinery, for example, testing devices, I would like those to be approved by the FDA in terms of their accuracy, because I'm basing entire protocols for people's health on these technologies. But when it comes to the FDA approving nutritional supplements, in short, folks, I just think there's too much corruption involved. And from what I have seen of prior attempts of the FDA to regulate supplements, is that they're harming the public more than they're helping. So, for example, fairly recently during COVID times, a particular nutritional compound known as N-acetylcysteine, or abbreviated NAC, was pulled off the market. You couldn't get it on Amazon. And I wondered why that was. So I did some digging. I did some blood detective digging, and I found that the evidence for the use of NAC, or N-acetylcysteine, for COVID prophylaxis, trying to reduce one's risk of developing COVID in the first place, and that would happen if you can build a strong immune system, particularly an antiviral immune system, which NAC has been proved to do, is one reason. Secondly, N-acetylcysteine seems to reduce hospital stays in persons with COVID-19. It also tends to reduce long-term health problems secondary to COVID-19, the use of N-acetylcysteine. And this nutrient, this unbelievable natural compound, is what I call a real chelator. It actually does help chelate metals from the body. Now, some of you are thinking, well, there's bentonite clay that can do that, and spirulina is a chelator, and all these other things. Most of these natural chelators do not actually chelate very well at all. But NAC is so potent of a chelator, it's used even by, it's described in toxicology manuals and used in various hospital situations with people that have various types of toxicities. Another example of NAC's antitoxic effect is for Tylenol toxicity, which generally results in liver failure. NAC is the remedy of choice when someone overdoses with Tylenol. So, and again, I could just go on all day about NAC, but I'm going to leave it right there. So my point in bringing this example up is the FDA has regulated NAC so that we can't get it, or it's extremely difficult to purchase. So this is just one example, but there are many examples like this where I feel the risk to the public by using various nutritional supplements is far less than the health problems that they might experience, which they might have avoided or at least mitigated if they used N-acetylcysteine and some of these other supplements that have had similar histories here of the FDA trying to regulate them. So I believe that the proper use of nutritional supplements ultimately lies in the hands of the consumer, which is you guys, but secondarily, the nutritional practitioner must do their due diligence and know practically everything they need to know, everything they can know about particular supplements that they're using in their clinical practices. Now, most of you have heard of the recommended daily allowances, and there's something called recommended daily intakes and recommended daily needs. I'm just going to use the old terminology, recommended daily allowances. And the question that arises is, do foods provide us with the recommended daily allowances of different nutrients? And I think even more importantly, are the recommended daily allowances basic doses, or do they represent optimal doses that you should shoot for in terms of your intake of various nutrients throughout your day? Let me say this another way. If you were to look up the recommended daily allowance of vitamin C, it would be about 60 milligrams a day. And that's what you might receive in a glass of orange juice. So you might also assume that that recommended daily allowance, like all the other nutrient recommended daily allowances, is all that you need. Now, when you read labels, it might say something on the label like there is 500% the FDA level of, let's say, vitamin C in a particular, let's say, food product. And some people think, wow, that's a lot of vitamin C. Well, it's a lot compared to 60 milligrams, but is 60 milligrams enough? What does 60 milligrams represent? So I'm going to describe this to you in about a minute because this is an eye-opener. For example, there were studies of body levels of vitamin C in previous scientific studies that looked for what is the capacity of the body to hold on to vitamin C. And it was something over 2,000 milligrams. And the recommended daily allowances are formulated such that, and this is the key thing here, folks, what is the minimum dose of a nutrient like vitamin C, which we're saying is 60 milligrams? What is the minimum amount of the nutrient, of vitamin C in this case, that would allow the body to keep its steady state levels in the body? Let's call it 2,000 milligrams of vitamin C. We always want 2,000 in our bodies at any given time, but we're burning it off because we're alive, we're aging, we're dealing with inflammation. There are reasons why our body burns off the C. So what is the amount of vitamin C burned off that we can offset by intaking with food? And it's been said to be, with vitamin C, as I've said, 60 milligrams. Now, that's the minimum amount of a nutrient to prevent a deficiency in the person. The recommended daily allowances do not represent the amount of vitamin C or any other supplements that might be optimal for the person, let's say in a particular cancerous situation or autoimmune disease situation or pain syndrome situation. So their RDA levels, the recommended daily values, are the minimum amount to prevent a deficiency disease. And most doctors have confused the recommended daily allowances by interpreting them as meaning that's all that you need. It's a fundamental blunder that was not made clear to medical doctors and many other healthcare providers, even dietitians. But remember, I have a dietitian's license. I went to chiropractic school. I went to medical school. And medical school does not distinguish between what the optimal amount of a nutrient is as opposed to the minimum amount of nutrient that allows your body to keep a certain relatively stable amount of that nutrient in your body. So this is why practitioners, well, at least I can only speak for myself, this is why I might recommend various nutrients, including vitamin C and many others, at much higher levels, even thousands of times higher than the recommended daily allowances. And why wouldn't I want to do that? I don't want to merely meet someone's nutritional needs. If they have chronic health problems and they're hyper-utilizing nutrition, which means their body's burning up and is requiring much higher levels of nutrition than, let's say, someone who is not sick. And look, as a marathon runner, trail runner, weightlifter, the amount of nutrition that I need to maintain a certain amount of lean muscle mass and also to be able to run long distances but not lose muscle mass is much, much, much higher than recommended daily allowances. And the same would apply to your chronic health problem if you have one. You're going to need more nutrition and you're going to hyperutilize it. So the question is, are the recommended daily allowances enough to meet one's nutritional needs? Almost never, I would say. And what about the fact, and this is just what my patients tell me all the time, why do typical medical physicians seem to be against the use of nutritional supplements? Well, that's really a good question because, again, there are hundreds of thousands of nutritional studies that can be found in various medical databases like the National Library of Medicine and what's known as the Cochrane databases. These are the databases of scientific literature, both medical and nutritional. It's got abstract or summary articles from all the major health journals that are considered top of the line. And when you search here, and depending on what you're searching on, there is an unbelievable amount of study that comes up. For example, so right now in real time, I'm on my computer and I'm going into PubMed.com. And let's say I write cancer and nutrition and I click. Okay, so now I have 78,891 results. Let me repeat that. 78,891 results. Are most of them positive? Yes. Are some of them negative? Yes. So I'm looking here at one study that is called Nutrition and Cancer, Prevention and Survival. And if I click on that, the study outlines that the use of certain nutritional supplements will improve survival from cancer. And that's an easy one because most people who have cancers, they tend to die of malnutrition and infections, both of which are common side effects of the immunosuppressive nature of chemotherapy. But getting back to the question, why are so many medical doctors anti-nutrition? Well, they don't learn it. So that's number one. And if you don't learn something, you have very little patience for it. I even had one medical doctor tell me, Dr. Wald, if all this nutrition was valuable, I would have learned it in medical school. I mean, he actually said that. And that's completely wrong. Like I mentioned, I was just doing a search on cancer and nutrition. But what if someone says to me, Dr. Wald, is there any evidence that nutrition, let's say specifically vitamin E, reducing heart disease? So I'm typing that into PubMed.com and there are 625 results. If I click on one of these results, it's going to lead me to other studies that are very similar to this study that either support it or don't. So my point at going on PubMed.com right here with you live and seeing that these searches really don't take very long. It does take quite a bit of time, obviously, to read all the studies. But it's easy to initially just determine that there is potential for the use of many of these nutritional supplements. And medicine knows this. These doctors that are saying that nutrition does not work, well, they seem to be forgetting that the American Medical Association reported on vegetarianism and how that reduced one's risk of pretty much dying of anything. And then if someone has a vitamin D3 deficiency, at least these days, maybe not 10 years ago, but these days, you are given vitamin D, although I find most doctors recommend the wrong amount and they don't know how to follow up on it. And they certainly recommend calcium for osteoporosis. And if you had iron anemia, they're going to recommend iron for you. So I can go on and on and on. Magnesium with hypertension, even in a hospital-based setting. So they say they don't believe in nutrition and there's no studies, but they're forgetting that they actually do know a couple of things about nutrition. Okay. Which other question can I possibly ask? Okay, here's a good one. Are natural hormones better than synthetic hormones? Now, you might say, well, why do I care about hormones? Well, you can buy hormones, some hormones, in health food stores. You can buy pregnenolone, which is a precursor to progesterone, and also several other sex hormones. And they might be very useful. There's also adrenal hormone, which is called DHEA. Okay, DHEA, not DHA, which is a fish oil product, but DHEA, dehydroepiandrosterone, which is an adrenal hormone. So are synthetic hormones different or better than natural hormones? I can tell you that the literature on this is mixed because it depends on the condition. But generally speaking, synthetic hormones work just fine. And sometimes you want to use the synthetic versions of natural hormones because they can be synthesized with much greater purity than natural hormones. So I'll answer this question by saying that there are specific circumstances under which I would use natural hormones and specific circumstances under which I would use synthetic hormones. Okay? All right, everyone, take a breath. We're through some very important questions. We're going to continue with this line of questioning in just a moment. Just wanted to announce that you are listening to Ask the Blood Detective. My name is Dr. Michael Wald, and I am the original blood detective. That was because a grateful patient in my past credited me with diagnosing her with a condition that she suffered for over 5 years, had gone to a bunch of different practitioners, and I was able to diagnose her and help her get better by the use of my blood detective approach, which basically involves looking at lab work and interpreting the lab work nutritionally where that was appropriate and also medically. So, for example, if someone has a high cholesterol, we may say to that person that if this continues, you may have a higher risk of eventually getting a heart attack. Now, a medical doctor might prescribe, let's say, a statin medication to lower the cholesterol. But high cholesterol could mean that the person is insufficient or at least can benefit from supplemental niacin, which is B3, which is proved to lower cholesterol, but also vitamin E and red rice yeast, as long as it's taken at a dose of 3,000 milligrams or more, or fiber. So in other words, when I read a blood test and the cholesterol is elevated, in my mind, I'm thinking fiber, vitamin B3, vitamin E, red rice yeast, maybe polycosanols. There's a whole bunch of different potential nutritional associations for not just cholesterol, but from every other test that you can get done at a physician's office or a clinical nutritionist's office. And, to slightly digress for just a second, I believe that I've developed this opinion over years of communications with different types of physicians regarding nutrition, is they just are ignorant. They do not know what they don't know about nutrition. And when you have a person who is a physician who doesn't know, let's say, nutrition, their immediate response, this is what I've learned, and this is a generalization, but it's mostly true in my experience, that they protect what they know, and what they don't know, they dismiss. If nutrition doesn't support what they do, from a medical perspective, they will deny its use. And this is what we call cognitive dissonance, when you are presented with information that's apparently contradictory to what you know, and you simply dismiss it rather than carefully considering it. So we just have human mental error thinking problems and biases that are limiting the access of nutrition for the average individual who may want their medical doctor's opinion about nutrition. And I think that's a tragedy, again, because there is hardly a health condition that I can think of where supplements in terms of vitamins, minerals, phytonutrients made in nutritional supplement forms cannot potentially benefit a person. And that's a lost opportunity, obviously. So let me answer this next question, which is a very practical question. Are supplements best taken with foods or away from foods? Well, that depends on the supplements, and it depends on the supplements and the particular health problem. So, for example, If you are taking amino acid supplementation, which you might do to improve your brain function, because amino acids from the diet account for about 80% of the amino acids that the brain utilizes to make neurotransmitters that let us think and operate our central nervous systems. You would want to take those amino acids away from other foods. And when you do that, the amino acids are absorbed much more readily and more quickly than when they're diluted in foods. However, if I'm going to prescribe, let's say, stomach acid to a person that I think has malabsorption and is not absorbing well, usually I'll have them take that right at the start of a meal for obvious reasons. However, if I wanted to use, let's say, digestive enzymes, which may include some stomach acid, but also some pancreatic enzymes to digest protein, carbohydrates, and fats, like stomach acid, I would have a person take these pancreatic enzymes and stomach enzymes at the start of a meal. But if this individual, and that's, by the way, at the start of the meal, if a person has an absorption problem, because if their body's not making enough stomach acid and enzymes, then it's important that you give them with the food. Now, if an individual also suffers from, let's say, musculoskeletal or joint degeneration and pain, I might have them take a higher dose of enzymes and acids so that a certain amount of those enzymes and acids break down the food for better absorption, but there'll be some remaining. And those would get absorbed through the stomach and intestinal lining, and they can then circulate in the bloodstream, gobbling up or enzymatically digesting some cancer cells, antibodies, and other harmful things that are floating around in the bloodstream. So these stomach acids and enzymes can be used as metabolic enzymes to reduce pain. And those I would want to take away from foods, especially because if you have musculoskeletal aches and pains and you take enzymes and acids away from food, that means that those acids and enzymes will be used to reduce inflammation in the body metabolically. But if you take the enzymes and acids with the food, it's going to help you in a digestive capacity. Now, again, this is a vast generalization, but most nutritional supplements of various types are probably best taken with foods. But my best advice to you is to read the label and see what it says about when to take the nutrients. It'll say take them with food or away from food. Maybe sometimes they'll tell you by a certain amount of time, take them after foods. But then you want to listen to the individual instructions that your hopefully qualified nutritional healthcare provider gives you in terms of when and how to take the supplements. There are far too many nutritional supplements for me to go through which ones are best taken with food or away from food. And sometimes there are situations where, you have to have a person stop all of the nutritional supplements. So like before surgery, for example, my general advice to my patient is to discontinue all nutritional supplements a full 3 days before any surgery and for at least 3 days after, until I have the opportunity to assess them to see whether or not it is the appropriate time to reintroduce their supplements. The reason for having someone discontinue all their supplements before surgery, back in the old days, we used to say, well, don't take vitamin E or fish oil before surgery because, and even regular physicians say this, the surgeons, because they know that these nutrients can cause blood thinning and they don't want their patients to bleed excessively during or after the surgery. Now, they've been giving that advice for a few decades now. So remember, supplements are not supposed to work according to most physicians. So why would they be asking their clients not to take vitamin E and, let's say, fish oil before surgery? Now, the truth is many nutritional supplements have the potential of thinning blood, which is why I have a general rule that says stop all of your supplements, unless there's a really good reason why the person needs to continue a particular supplement, and sometimes there is. So in other words, if someone is using gamma aminobutyric acid, to, let's say, elevate their mood or for their pain or for sleep or their depression or anxiety, which GABA can help potentially, then I might not want to eliminate that one. And I happen to know that that particular compound, GABA, does not produce blood thinning. But sometimes just for ease of everything and clarity between my clients and myself, I'll have them just continue everything. But there are times where you want to continue. must be taken on an individual basis. And this next question that was posed to me by someone out there in the listening audience is similar to the first question, which was, we started off with at the top of the show, do nutritional supplements work? So this one is, do you need to take vitamins, minerals, and other nutritional supplements in addition to a balanced diet? So let's assume for a moment that we all agree on what a balanced diet is, just for the sake of argument, okay? Because a balanced diet, well, what do you even mean by balance? That's a whole other question. And healthy is also another question, because a particular diet may be healthy for a person, let's say, with non-Hodgkin's lymphoma, but that same so-called healthy diet for that cancer may not be appropriate for, let's say, pancreatic cancer. And the diet for pancreatic cancer might be very different than the optimal diet for someone with lupus, let's say. But again, let's assume we know what the optimal diet is. If we could achieve an optimal diet, again, we must define optimal. And I think the safest way to do that is to say that an optimal diet is a diet that provides the minimum amount of various nutritional supplements. And we talked about the recommended daily allowances. Those are minimum amounts to prevent a deficiency from showing up in a person. They're not the optimal amount to optimize health. So I believe that the answer to, do we need to take nutritional supplements in addition to a balanced diet, is almost always yes. Because even if you reach this balanced diet, which has all the levels of the minimum levels of the recommended daily allowances, and you have any health problem at all that's chronic, you're going to need nutrition across the board, and more nutrition, more of certain types of nutrition than others, across the board. So the recommended daily allowances are just invalidated just right off the bat. One of the things that I do with my patients is I will evaluate their food intake for 5 or 7 days. And even when on paper it seems that people are meeting the recommended daily allowances for all the major macronutrients and all the major micronutrients, many of them are still sick. But when I give them much higher doses of vitamin C or vitamin D or resveratrol or whatever their chemistry says that they need, they get better. Or at least they heal better over time, or they improve to some extent most of the time, which demonstrates to me that diet alone is not it. Now, depending on the reason why someone comes to see me, I may start with a very different diet than another person, or a food plan, let's call it, right? And I always try to make sure that whatever food suggestions I give to a person are doable, but I let them know that these food adjustments, what they're eating, may need to change based upon their compliance or lack of compliance, how the natural course or the treatment course of their condition is responding to medical and nutritional therapies. And I might have to change their optimal diet from one thing to quite another thing, depending, again, on where they are in their treatment. And the same goes for the use of nutritional supplements. Doses may go up and down. Certain nutrients I might add in at one time, and then later on I might remove them. I might adjust the ratios and dosages. Again, and the timing of nutritional supplements depending on how everything is progressing. And I want to emphasize the concept I spoke about earlier about, how do you know if the supplements you're taking are of good quality? Well, you want to take pharmaceutical grade products, and how you know is, again, you call up the company, you ask them for a third-party assay of the quality, and if they say to you, what is that? Obviously, you want to switch companies. If they say to you, absolutely, we'll send it to you, and they never do, switch companies. I love it when my clients ask me for full disclosure labels of quality, because I have those third-party assays that show that the supplements have met specific purity and quality control standards. Why would a person want to take anything less than that? Well, many people, I would even say most people who take supplements, are not taking the highest quality available. And many of these individuals, as a result, are wasting a lot of money and a lot of valuable time in their lives when things are actually not working. So ultimately, a person needs to be improved in their health concerns. So that's certainly a sign that their nutritional supplements may be working. But in addition to a person feeling better, I always insist on correlating someone feeling better with improvements in their actual abnormal chemistries. If someone's feeling better and their chemistries are not improved, and sometimes they might even be worse and a person might feel better, then those are not the kind of supplements that are going to produce long-term improvements. Here's a really popular question that people ask me. Some of my clients are confused, particularly earlier on when I meet with them. They might be on a multivitamin, and I might suggest, let's say, extra CoQ10, or I might suggest, let's say, resveratrol or biotin or more B12 or whatever the supplement is. And they say, well, Dr. Wald, why are you giving me this extra supplement? Because it's already in my multi. Doesn't my multivitamin have everything? The long and short of it is no. A multivitamin does not nearly have everything. There are hundreds, if not thousands, of nutritional compounds. But sometimes a multivitamin, if it's composed correctly, meaning it's got the correct ratios of different nutritional supplements, and the types of supplements are of the most activated forms. So in other words, you can buy, let's say, zinc orotate. That happens to be good for ulcers. And zinc picolinate might be used for general immunity, but zinc gluconate doesn't work systemically well at all, but is very good for, let's say, a sore throat. So different types of zinc or different types of vitamin C or different types of B12 or different types of folic acid are used for different health problems. And they may not all conveniently be in a multivitamin. But a multivitamin, generally speaking, is probably safe and is for fundamental use. But then on top of that, one needs to consume in either supplemental or food form greater amounts of other nutrients they need based on their chemistries, based on their health conditions, based on my experience of what their needs are, to ensure that they have ideal amounts of nutrition. So a multivitamin does not contain everything that you need. And one other thing I'll say about that is that I will say to a client, your multivitamin represents sort of a baseline. And let's say your multivitamin has magnesium in it, which all of them do. But if the person has hypertension, they might need 10, 15, 20 times the magnesium in the multi. So then I give them that separately. So I idealize their nutritional needs using the multi as a baseline. And here's a question that I received from someone out there. And this is something I hear all the time. People will say to me, Dr. Wald, what is the most important supplement or supplements for the average person? And I'm shocked, just like I am now. I don't even quite know how to answer the question because what's an average individual? There is no average individual. So the question is, what are the most important nutritional supplements for the average individual? I can only say when I have a particular person who's presented in front of me with a specific health problem that I've become familiar with, is what are the most important nutritional supplements for this individual at this time, at what doses, with what timing. And that might change a week from now or 3 days or a month from now or a year from now. And nutritional requirements are constantly changing. And adjustments should be made based upon a variety of factors, including, again, how the labs change, how the person feels, and so forth. And then people will ask me, okay, Dr. Wald, I get it. There's no average person. There's no best supplements for the average person. But if you had to guess, Dr. Wald, what are the most important, handful of supplements that people might take? Okay, so I'm going to attempt to answer that question. I would say, based on my 33 years of experience, that vitamin D3 in its activated form is probably one of the most important supplements for most people. Vitamin D receptors are found in virtually every tissue of the body. That's not true of every vitamin. And this is one of the reasons why it's been discovered fairly recently, we'll say 15, maybe 20 years. That may seem like a long time to some of you, but in the sciences, that's not a whole lot of time. That over this period of time, physicians of all types, I've observed in my practice, will order vitamin D3 testing because they know, for example, in endocrinology or hormone doctors know that vitamin D is a pre-hormone or a pro-hormone, and it's needed to regulate various hormones. And let's say in the field of gastroenterology, they know that low levels of vitamin D are associated with increased risk of cancer. And we know in cardiology that low vitamin D levels result in increased cardiovascular risk. In the area of rheumatology, we know that low vitamin D is associated with a worse course of virtually all autoimmune diseases. Now, I can go on with the uses of vitamin D in all areas of health. And this is why vitamin D3 is one of the most important nutrients you can take. And this time in human history, N-acetylcysteine would be my next pick, or at least my next consideration as one of, let's say, my top 3 nutritional supplements, because N-acetylcysteine, as I mentioned earlier, is a chelator of metals. It helps bring heavy metals out of the body. Now, I'm not saying cysteine. I'm saying N-acetylcysteine, or NAC, or NAC. Okay, it's also an antiviral agent. It's an antibacterial agent. It's an antifungal agent. It's an antiparasitic agent. N-acetylcysteine is the compound that is now recommended to people who are born with cystic fibrosis, which is a genetic condition resulting from excessive mucus formation in the lungs, which causes lung infections and usually reduces the lifespan dramatically. But since the regular use of N-acetylcysteine in the form of a drug called Mucomyst, that's extended the lives of persons with cystic fibrosis by over a decade, maybe even as many as 2 decades in some cases, based on some estimations. We also know that NAC is an extremely potent antioxidant and anti-inflammatory, many times more potent than vitamin C and E, but not in every circumstance. Now, generally speaking, when we think about what are the most important supplements, we need to think about what are the most important supplements for a particular individual at a particular time. So if someone comes to me and they've had a heart attack, one of the most important initial supplements would be whatever nutrients target the reasons for this person's heart attack. If this person had a heart attack because of cholesterol clogging a coronary artery, then niacin might be a really important nutrient for them. If someone has dementia, let's say early dementia, and you want to slow that down, the most important supplement for them must include omega-3 fatty acids based on what the scientific and medical literature says. So as you're probably gathering, right, everyone? You can't really say what are the 3 or 5 or 10 most important supplements, because that depends on what the individual needs. So when I figure out the nutritional supplement protocols for my clients, sometimes I might recommend, 5 or 6 or 7, 8, maybe even 10 different nutritional supplements. And some people cannot take that many supplements. So I'm forced to prioritize them. So the first thing I start to think about is, okay, so what are the patient's lab abnormalities and nutritional needs? If they can't be met with food, which nutritional supplements are now the most important as we progress? And that's how I figure it out. And the same type of thinking should be applied to the other popular question I get, and that is, they'll say, Dr. Wald, what are the most important supplements to reduce inflammation? And I'll add in there, not just to reduce inflammation, but just to age better overall. So there are many types of inflammation, folks, and it can be measured in various ways. There's a test called the erythrocyte sedimentation rate, or ESR, which is a very popular, if not the most popular, inflammatory test performed in medicine, generally speaking by rheumatologists, but also by internists and family practitioners. But any practitioner could, of course, order these tests. And then there's inflammation that raises the CRP, or C-reactive protein. Is inflammation that is caused by the elevation of interleukins or cytokines. Again, these fancy terms just represent other types of inflammatory mediators. So the nutrition to manage someone's inflammation must be targeted to the type and the extent of the inflammation in the context of what else is going on with the person. And the ideal nutritional supplements also have to be based on how the individual reacts to supplements, because one person might react really well to vitamin C and another patient might react very poorly to vitamin C due to all kinds of circumstances. So this is why individualization of nutrition is always the rule. And that's what being your own blood detective is about. Detecting and searching and researching how and what nutritional supplements are best for you. And that is usually a trial and error process, which should be undertaken with a trained and highly qualified nutritional specialist. And just a word on that, which I'll formulate into a question. People will ask me, Dr. Wald, who is the best person or people to see to improve my nutrition? The first thought that comes up is a dietitian, but traditional dietitians are basing their advice on very old science. And I can tell you that because I am a dietitian and that's what we were told. A certified nutrition specialist, in my experience, and I am also a certified nutritional specialist or CNS, that is a little more advanced than the average dietitian. CNSs do learn about the use of nutritional supplements and more holistic types of approaches. There's nothing holistic taught in the traditional dietitian protocols and degrees in various colleges. And then some nutritional practitioners like myself have board certifications, which are generally on average about 2 years of additional nutritional training. I have 2 board certifications. So that's 4 more years of nutritional training, and I have a CNS, and I'm a dietitian, and I learned chiropractic in nutrition in chiropractic school. In medical school, I could count on my hands and my toes how many hours of nutritional education I had. Not a lot. A good amount of nutritional practitioners these days are reading laboratory tests when they should not, because they're not taught how to do that. And I would say that you'd want to see a qualified nutrition specialist that also has a doctorate that allows them to properly interpret lab work, because if you can base your nutritional needs on your actual chemistry, if it's read right, along with other factors like, again, what the literature says you need, and then your genetics, and then the particulars of any medications you might be on, and what your symptoms are. There's all sorts of factors that have to be taken into consideration, and more highly qualified practitioners are the ones for these types of situations. Last question. What's the difference, people will say to me, Dr. Wall, between the intake of nutritional supplements for like absorption and activation? What's the difference between absorption and activation? Well, look, we've all heard of that old adage, you are what you eat. You're not. You are what you absorb from what you eat. Now, when you absorb nutrients, your body then needs to activate these nutrients in the liver for them to be able to be used optimally in the body. But it's actually not just in the liver. For example, when you eat foods with calcium, your stomach acid will break or cleave your calcium from your proteins, and the stomach acid ionizes or turns on the calcium so it can be used. If you're over 50, you're not making much stomach acid. You might not ionize your calcium very well, and that calcium will stick in your arteries, causing hardening of the arteries. It can go into the breast tissue, causing calcium breast cysts, which can cause breast cancer. Calcium can microscopically accumulate in your muscles, causing fibromyalgia type symptoms. So there's absorption and there's activation of nutrients in your digestive tract and with the help of your pancreas and also your liver at the very least. So big difference between what you're taking in and what you're actually activating. And again, how do you know? Well, ultimately, you must get better symptomatically and your biochemistry needs to change. I want to thank all of you so much for these questions. You've been listening to Ask the Blood Detective. My name is Dr. Michael Wald. I can be reached at 914-552-1442. You can email me at info@blooddetective.com and check out my free content at drmichaelwald.com. That's drmichaelwald.com. Take care, everyone. It's been a pleasure.